and that's a problem. I mean, in some of the hats that I wear in some of the places, I mean, I see sort of 14-year-old kids who are getting thousands and thousands of dollars on healthcare for things that seem largely kind of incidental, and likewise you see other populations who have really things that ought to be getting sort of, as you say, $100 spent early for preventative care that could do a lot, that don't get that until they come much later. And then some of that is urban and rural, most of that is economics, a lot of it is race-based. And we've got a long way to go. I think that the ACA, no question, is a big step forward in terms of trying to bring those populations up to a level of more parity. I think there are a lot of forces in America that are pushing against that, but those disparities exist to anyone who wants to look for them, and we're making progress. We're well on the way.
Progress is good. Anybody else on that?
I think Medicaid expansion in particular did a lot to address this. So people, who, because of their income level, or if they whether or not they have children, or whether or not they have a disability, they can then, despite all that, they can now become eligible for Medicaid under the ACA. And from Planned Parenthood's perspective, at least, about 40% of our patients are patients who use Medicaid. And I don't know the exact numbers, but I'm guessing that did go up once the ACA came into effect. So more people had access to birth control and to preventative health care. And for a lot of people, especially women, especially low-income women, especially low-income women of color, going to a family planning doctor, whether or not it's Planned Parenthood, is usually, can sometimes be the only health care that they get. And so Planned Parenthood is in, our clinics are in a lot of medically underserved areas, which sometimes also happen to be rural areas. And so to cut people off, to target Medicaid, to cut back Medicaid expansion, or to block Planned Parenthood from participating in the Medicaid program is, to me, a direct attack on low-income communities, on women, and on communities of color. So I think there definitely is this disparity, and there's forces in our country who are, whether or not that's what they're saying they're doing, that is what they're doing when they're limiting taxes.
Yeah, I don't think there's any debate that the Affordable Care Act has reduced disparities. And the disparities are largely economic. If you're poor, whether you're a minority or Caucasian, doesn't make any difference. You still have problems. If you're rural or urban, it's really a matter of can you afford to have health care. So I think it did, in fact, it didn't eradicate the disparities, but it did lessen them in all aspects. And in fact, when you look at where the funding came from to provide the subsidies, it was a transfer of wealth. And to your point, the biggest source of funding was from rich people. Okay? And so there's a tax on unearned income, which is investments, and who has investments, and for people who make over $200,000 a year. So there was a big transfer of wealth from that group, from the groups I talked about, whether it's the plans or the medical device companies or the pharma companies. All of those sort of paid into the pool that provided the subsidies. So in that regard, I think whether you like it or not, you can argue whether that was a good thing or a bad thing. But the fact is that what the Affordable Care Act did was it took money from corporations and wealthy people and used it to make healthcare